When encountering a patient in distress, the novice practitioner often falls into a predictable trap. They feel the pulse, declare a generalized imbalance, and prescribe a broad-spectrum treatment. And yet, the patient's condition remains entirely unresolved. The error lies in treating the imbalance as if a dosha were a tangible physical substance, a rogue fluid, or a generic energy floating through the body. In clinical practice, diagnosing a dosha this way is guaranteed to fail. To practice precise medicine, you must define the Tridosha, Vata, Pitta, and Kapha, exactly as the texts do, as strict functional regulatory principles. Vata governs movement, Pitta governs transformation, and Kapha provides stability. This requires abandoning this simple binary of diagnosing a dosha as merely high or low. Instead, the physician must construct a multidimensional diagnostic matrix to trace functional deviations back to their precise systemic roots. Accurate diagnosis demands isolating specific subsystems, establishing the permanent starting baseline, and tracking the chronological pathogenesis. Clinical mastery requires the mathematical alignment of specific system failures. The human physiological system relies on three primary operational engines: Gati, or movement, Parinama, or transformation, and Dharana, providing stability and support. This architectural grid outlines Vata, Pitta, and Kapha. These three functions are not arbitrary concepts. They are the direct mechanical output of specific elemental combinations, known as Pancha Mahabhuta. By blending Akasha, or ether, with Vayu, or air, the system generates Vata's core directive of movement. Its inherent mobility stems entirely from these elemental inputs. Moving to the second column, Agni, or fire, combines with Jala, water. This specific interaction creates Pitta's capacity for thermal regulation, digestion, and metabolic transformation. Finally, the combination of Prithvi, earth, and Jala, water, yields heavy, cohesive properties. This forms the structural stability and lubrication governed by Kapha. Because this elemental composition dictates every physiological action, any systemic breakdown encountered in the clinic must be analyzed at its core as an elemental breakdown. Knowing the macro-level element, however, is insufficient for a prescription. We must isolate the problem into localized functional nodes. Look at Vata. It does not act as a single, uniform entity. It operates through 5 distinct subtypes, classified strictly by their anatomical location and their specific functional output: Prana, Udana, Samana, Vyana, and Apana. Consider a patient presenting with severe constipation and difficult evacuation. We know Vata is responsible for movement, and here, movement has stalled. The diagnostic matrix bypasses the first 4 nodes entirely. Prana governs respiration, Udana controls speech, Samana dictates digestion, Vyana manages circulation. The failure is not in respiratory or circulatory channels. The failure resides entirely within the 5th node. Apana Vata operates in the pelvic region, exclusively governing downward movement and elimination. Prescribing a therapy to lower general Vata in this scenario is clinically useless. Precision medicine requires targeting and calibrating the localized Apana subsystem. Before correcting that localized failure, the matrix requires you to establish the patient's starting parameters. You cannot measure a pathological deviation without first knowing the healthy baseline. We define this baseline as Prakriti, the individual's relatively stable constitutional state. Here we see a permanent, heat-driven Pitta predominant constitution. Right beside it is Vikriti, representing the present state of physiological disruption. In this case, we see a severe Vata spike. This presents a clinical paradox. A person with a permanent Pitta constitution can simultaneously suffer from a cold, erratic Vata pathology. Confusing Prakriti with Vikriti guarantees diagnostic failure. If you treat the patient's lifelong Pitta identity instead of their current Vata pathology, you will actively exacerbate the disease. Once the baseline and the specific subsystem are identified, we must map the chronology of the breakdown. This sequence is called Samprapti, the exact chronological cascade of how a functional error becomes a physical disease. It starts with Nidana, the initial cause, leading to Dosha Sanchaya, silent accumulation. It aggravates into Prakopa, then overflows into Prasara, spreading systemically. Next comes Sthana Samshraya, localization, embedding into a physical Srotas and Dusha. This forces manifestation in Vyakti, eventually degrading into beta complications. Physical symptoms are never sudden occurrences. They are the predictable, late-stage manifestations of a meticulously mapped chronological cascade. Let us return to our case study of constipation to run the final calculation. We apply this pathogenesis logic directly to the Apana Vata subsystem. The exact point of symptom manifestation occurred during Sthana Samshraya, when the aggravated Apana Vata collided with the Parishava Srotis, the physical excretory channel. This gives us the ultimate diagnostic sequence that a clinician must answer. Which dosha, which srotis, which dosha, where is the localization, and what is the exact stage of samprapti? Only when all 5 variables of this matrix are solved can an accurate intervention begin. Ayurveda operates on strict physiological logic. It relies entirely on the precise mapping of functional subsystems, strict baseline differentiation, and tracing the exact path of localized pathogenesis.